Hello, this is Frederick Holt. I'll be the nurse today. Here's my ID. This is our patient, John Doe. He is the one being examined today. Before we begin, do you consent to being examined and having it posted and reviewed by an instructor?
I do.
Okay, good. Alright, so just beginning, I'm going to ask a couple questions. So your reason for visit today is just an examination before going to college?
Correct.
Okay. And do you have any prior health history or family history related to health?
I do not.
Okay. Well, I'm going to begin the exam. So, can you tell me your name?
John Doe.
And today's is what is today?
Sunday.
Sunday. And who's the current president?
Joe Biden.
Okay. And where are you at today?
Sacred Heart Hospital.
Perfect. Okay. Looking at the patient, his skin appears within normal limits. Normal. I'm going to just feel. And I'll continue throughout the assessment. Skin feels normal, moist, warm. Appears rather nourished, within well health. Going forward. I'm just going to start off at the top at your head. I'm just going to look at your scalp. Hairs within expected limits. No dryness in the scalp. Normal moisture. No lesions on the skin. Also, the patient appears current age, which is 19. Alright. And going down from there. Are you in any pain today?
I'm not.
Not? Okay. And we're just going to do your vitals real quick. Do a quick blood pressure on you. Get your vitals. Can you slip your arm through there? Thank you. And here we're just going to take his blood pressure. You can relax your arm. Now you will feel a tight squeeze, but it'll only be momentarily. Patient's blood pressure is 122/96. Okay. I'm going to take your temperature. And you just place this under your tongue. Thank you. And you hold it if you like. And while we're doing that, I'm going to go ahead and get your pulse. Perfect. 98.6. Vitals appear good, blood pressure is good, respirations are normal, unlabored, no excessive shoulder movement. 12. Inhaling and on expiration. And do you know about how tall you are and
I'm 6 feet tall.
and how much do you weigh?
185.
Okay. And just to get your BMI, we're going to simulate this. We would get your, may I see your arm? We'd use our skin calipers and measure underneath the skin underneath the arm with these calipers and get a rough estimate of your BMI. He appears to be physically fit and will be in normal range of BMI for his age. Okay. Forward. I'm going to just start with your face. Alright. Facial symmetry, normal skins, no lesions. Color as expected. Alright, I'm just going to feel your temporal artery now. Okay. And your TMJ. You open and close, open, close. All are within expected parameters. Now we're going to go into your eyes. This is going to be the pen white. I'm just looking for perla, that your pupils are equal, round, responsive to light, and accommodate. So just look forward for me. Pupils do respond to light, and they're about 3 millimeters. And if you could just follow the tip of this pen right here. Perfect, thank you. And you have no problem seeing?
No problems.
No problems? No contacts or glasses?
None.
None? Okay, perfect. For this next test, we're going to darken the room, and I'm going to use my ophthalmoscope, which is also going to be simulated. We're just going to take a look into your eyes, at your ocular fundus, and look for the red disc. And that is also within expected parameters. And while we're there, we also observed the sclera, conjunctiva, and cornea. No scratches, pupils are white, no popped blood vessels, everything seems good. So now we're going to go to your ears. So I'm just going to feel the outside of your ear. Let me know if there's any pain or tenderness, okay? And you weren't in any pain today, correct?
I was not.
Okay. No pain or tenderness with that?
Nope.
Okay. Now I'm going to go with my otoscope. I'm going to look in and I'm going to assess his tympanic membrane and ear canal. Make sure there's no redness or swelling. Assess bilaterally. And all appear within expected parameters. No redness, swelling. And you have no problems hearing?
I do not.
Okay, we're going to do a whisper test now. Just repeat what I say to you. I'm going to whisper in one ear and we'll go forward from there.
Today is Sunday.
Okay, and I'm going to whisper in the other ear.
Tomorrow is Monday.
Alright, patient has no problem hearing. Alright. Now, moving towards the nose. Nose is symmetrical, no problems with that, no dryness. And do you have any problems breathing?
I do not.
No. And this is where we would use the speculum to look inside of the nose, to look at the septum and the normal mucosa and his nasal cavity. And we're going to look at that. And can you just look up for me? Okay. So we look in there bilaterally. No redness, no swelling. Appears moist, and like he said, no problems breathing. Okay. Just going down to the throat, the neck area, or mouth area next. Could you open for me? Open your mouth. Alright. Mouth is moist. No problems with teeth, no problems with the bottom of his palate or the top of his palate. Teeth are normal, tongue is normal. Can you say ah, ah, and stick your tongue out? Thank you. There's normal. And you have no problem eating or chewing?
No problems.
No problems. Good, good. And there. This patient also had a tonsillectomy, so he no longer has tonsils, or else I would grade them. So, going down. I'm now going to assess your throat and trachea. So, like you said, no problems breathing or eating?
Nope.
No. Alright, I'm just going to feel your carotid artery. Alright, just feeling for a pulse here. Now I'm going to listen to your carotid bruit. Within expected parameters. No bounding pulses or weak or thready. Now, if you could just turn to the side, I'm going to assess your thyroid gland now. Tell me if there's any pain or swelling with this once I'm done. No pain or swelling with that? Or
No pain,
or
no swelling.
tenderness? Yeah, no swelling is noted. Appears to not be enlarged. Also going to assess your trachea now. And can you swallow? Thank you. Trachea seems to be within expected parameters. Alright, now I'm just going to have you lay down, Mr. Duff. Alright, Mr. Duff, I'm going to feel your jugular veins now. Perfect. Thank you. Now, Mr. John Duff, I'm going to ask you to pull up your shirt. And this is where we would assess the pericardium. We're looking for any thrills. You can also use tangential lighting to assess for any impulses against the chest wall. So we're going to do that first. Within expected parameters. And we're going to feel, palpate. Okay. Now I'm just going to listen to your heart. No problems with chest pain or
None.
tenderness there?
None.
Okay. First, we're going to listen with the diaphragm. Next with the bell. Now we're going to listen to his apical pulse, which is located in the 5th intercostal region. No S1, no murmurs noted, and pulses as expected at the apical pulse. So there's no pain with that at all, Mr. Duff?
No pain.
No pain. Okay. Moving down, we're going to assess your abdomen now. Okay. First, I'm going to look. The color is as expected. No swelling, no redness, no lumps, no abnormalities in general. Okay. Now we're going to listen. I'm going to listen to his bowel sounds. All quadrants are active. Now we'll percuss. Now we're going to palpate. We're just going to feel, and you tell me if there's any tenderness or pain, specifically in the regions. If there is, let me know as I'm doing it, and let me know if it's any more severe in one spot than the other. No pain there?
No pain.
No tenderness in any?
No tenderness.
Okay, good. also going to go ahead and palpate your liver. So let's be on the right side. Just feeling for any lumps, any tenderness, just let me know. No lumps, no swelling. Seems to be in the normal state. No tenderness with that.
No tenderness.
Okay. We're going to move to the kidneys now. No tenderness.
No tenderness.
Still no tenderness.
No tenderness.
Okay. And the spleen. Any tenderness there?
No tenderness.
Okay. So all felt within expected parameters. No swelling. No lumps. And now going down. Do you have any problems using the bathroom, Mr. Doe?
I do not.
No. And when was the last time that you had a bowel movement?
This morning.
This morning. Okay. You can go ahead and pull your shirt down, Mr. Duff. And down by your legs. Colors as expected. No problems. No lesions noted. Now, do you have any problems walking or moving?
I do not.
Do not. Do you use any assistive devices to move?
I do not.
Okay. I'm just going to go ahead and assess your pulses. Alright. Okay. Alright. Your P pulse. Okay. Pulses are all expected. No bounding, no weak, thready pulses. We're going to come down to your feet now. Okay. Can you spread your toes? I'm just going to look in between. No abnormalities, no swelling, no redness, no cuts, no lesions. And can you bring your feet towards yourself? Alright. And push. Alright, regular strength. And can you pull your knee to your chest? No problems with that?
No problems.
And the other one? No problems?
No problems.
Okay. Well, Mr. Duff, can I have you sit up now? Lastly, we're going to assess two last things. I just need to look at your hands. Can you hold them out? Okay. Skin says normal. No lesions, no swellings. Cap refill is less than 3 seconds. And one last thing, I need you to just lift up your shirt one more time. And skin turgor is normal, returns. Well, thank you for your time, Mr. Doe. And
You're welcome.